April Green here, registered nurse at CSC. Today we're going to be talking about the gynecomastia surgery. If you haven't already went and watched the general surgery information video, then go ahead and do that before you watch this one. So the items that you'll need for this surgery is your lab work and your prescription medications that you'll get at your pre-op. You'll need some Johnson & Johnson Surgipad dressing pads or something similar to it, like even feminine maxi pads work. And then you'll need some hydrogen peroxide and distilled water and some Q-tips to clean your incision sites with. So make sure you wear a loose button-up or zip-up top to your surgery. We already discussed that in the general surgery information video, but just reiterating it here so that whenever you do put that vest on, or actually you're going to be going home in the vest, we put it on you after surgery, but it needs to be loose enough to where that can go underneath. So after your surgery, we are going to want you to restart your antibiotic and your cynic medication that we'll tell you about at your pre-op. And you can take that with a light meal or even like some crackers and some Gatorade or something, just to have something on your stomach so you don't get nauseous or anything from taking those. You are going to sleep in a semi-sitting position for about 2 days after surgery. So this can either be propped up on pillows in your bed, or if your bed inclines, you can also use that feature, or you can sleep in a recliner, whichever one that you feel more comfortable using. So your first post-op appointment normally is either the day after your surgery, if it's more of a kind of like you have bigger pendulous breast tissue and it's more like kind of like a breast lift gynecomastia thing. You might need to see us the next day, but most people are going to see us about a week after their surgery. So whenever you do take a shower, normally the next day, unless you have to see us before that next day, you're going to take it after that. So you'll get in the shower and just let the water kind of trickle down your breasts. You don't have to soap them up really well or anything, just kind of soap up here and let everything trickle down. Don't get directly in your water pressure. If you have like really hard water pressure, try to kind of turn around and then just let it kind of come down. So you might have some white tape over your incision areas, and if you do, you're going to leave that on until we take that off at the follow-up appointment. So you're not going to mess with that. If it tries to come undone after you get out of the shower or like try to come off, then just kind of pat it down with a dry washcloth, and then you can even use a blow dryer if you have one available on a cool setting, no heat. And kind of blow dry it back down. If it's still not going back down, then just give us a call and we can always give you more tape. And then you're going to cover your incision area after that with those little dressing pads and then put on your vest. Like I said, don't remove that tape at all. We'll remove it at your post-op visit. And then sometimes you might want to do, Dr. Brandon might want to do an additional week of tape. It just depends on kind of what the amount of tissue you had in your surgery and how your swelling is and stuff like that. But for 4 weeks after surgery, we don't want you to do any lifting, pushing, pulling, or straining, working out, running, any of that. No lifting more than 10 pounds for that first week is very important, and then no more than 20 pounds for the next 3 weeks. If you should ever develop any significant pain in one breast with significant swelling, like around your collarbone or like deep purple bruising on your chest, then give us a call for any of that. Also avoid direct sun exposure to your incision sites because this will kind of make them darken up for about 6 to 12 months. You want to avoid the sun. So sunscreen, a shirt, whatever you want to do there. You can start driving again about after 72 hours if you aren't taking your pain medicine anymore, or if you're not kind of like limited due to pain, since you do use your chest a little bit whenever you drive with your arms. Just know that it can take about 6 months to a year for your chest breasts to settle into their final looking appearance. So be patient with that. And also no tub baths, lakes, oceans, hot tubs, any of that for about 4 to 6 weeks after surgery. So just showers only is the only thing that you can do. So if you don't have white tape on your chest after your surgery, If you just maybe have like a little steri strip, you'll start cleaning those incision sites whenever Dr. Brandon gives you the okay. So normally if you just have the little steri strips or kind of like clear little white tape around one little incision area, then you'll take those off after 5 days and start cleaning. But if you have the white tape, we'll take it off in the office. So just call if you're unsure. If you don't know, then it's just always better to call than to take anything off that we don't want off yet. So that is about it, y'all. I don't think I mentioned exactly what those dressing pads were for. So whenever we do the little bit of liposuction to get that fat out of the breast, we have to put what's called tumescent inside, and it kind of breaks up that fat so that we can pull it out and helps with bleeding and stuff. So you might be a little bit oozy out of your incision sites for the first like 72 hours if you do have those little steri strips. So that kind of helps pad the incision area, and it kind of also helps with compression. So you'll know after your surgery if you need to keep padding that over the 72 hours or not. It's very kind of dependent on, like I said, your size of your breast tissue, the swelling after, and such like that. So like I said, if you're unsure, then give us a call. Hey guys, I just wanted to talk a little bit more about that vest we spoke of in the video. So you'll have a vest on after your surgery that we want you to keep on for about normally 2 weeks after your surgery, and that helps with compression and swelling and helps you get that best result that you're looking for. So you're gonna wear that at all times for about 2 weeks until Dr. Brandon tells you you can stop wearing it. So whenever you shower, you can take it off, and whenever you need to like wash it, you can take it off, obviously, and do that, but you just need to put it right back on. So I just wanted to reiterate that because we didn't really talk about how long you needed to keep it on. So that's that.